I would like to explain a little bit more about your condition and how it can be affecting you.
When I went to sleep at night and laid that foot on the one side, I'd get a pain so bad I'd have to wake up and hope by standing up it would subside to an extent that I could go back to sleep.
I had tingling from my knees down to my feet all the way, constant tingling, and I couldn't hardly walk. If I sit in a hard chair, as you do at the table, the separation pause or something like that with my wife, I couldn't stay there more than maybe 10 minutes.
My equilibrium was getting very bad, and I was quite concerned with that as much as more than I was my foot.
Anytime I try to walk any distance, I have to change shoes so frequently because I might rub a place on my foot that I don't feel until after I take the shoes off. It's just a daily thing that wears on me, and I have a hard time accepting the fact that I'm just going to have to live with it, you know.
Let me share some facts and research about neuropathy with you. Chances are, if you're suffering from neuropathy, your symptoms may include burning, tingling, weakness, pain in your toes, your feet, coming up your legs, possibly in your hands and your arms. These are all the symptoms of neuropathy. In fact, some people's pain is so bad that they actually have what's called restless leg syndrome, where they're kept awake all hours of the night due to the pain in their legs. This, unfortunately, interrupts their sleep pattern, usually that of their spouse also. It tends to make people very cranky and irritable when they don't get their rest. In addition to that, there's usually a component of vertigo, and when you can't feel your feet or your hands, oftentimes you become injured in some way and you don't even realize you're injured. You can actually get cuts and foot infections and all types of things because you can't feel it. You don't know it's there, and these can be quite difficult to deal with and really affect your health. In addition to that, if you're not feeling your feet, oftentimes you don't know where you're walking, and this causes you to trip. Now here's the problem: when you trip, oftentimes you're going to fall. When you fall, there's a great possibility that you'll actually fracture your hip. Now, if you fracture your hip, what the research shows is that 60% of those people who fall, fracture their hip, are actually going to die of complications arising from the fracture. That means your mortality, that you can actually die from this. In addition to that, if you've already fallen, the research shows that within 6 months you have a 100% chance of falling again. These are really bad odds of a lot of risk, a lot of injury, and like I said, possibly death. In addition to that, once you start going down this road of not being able to walk and feel your feet, you start using ambulatory aids such as canes, wheelchairs, walkers, and your ability to function and stay independent starts to drop dramatically. And as your independence drops, your interdependence on your spouse and others really starts to come up. In fact, a lot of people actually end up in a nursing home way before they should have ever been there. So for us, it's very important that you maintain the function of these nerves to remain ambulatory, to remain healthy, doing the things you love, whether it's playing with your grandchildren, golfing, walking, just enjoying where you're going and who you're with, which again, neuropathy interferes with those things. Chances are you know somebody this has already happened to. You don't want to join the ranks of these folks.
I got to be 80 years old and I was bragging to people. I feel like I'm 45, 50 years old. I said, I'm golfing, I'm going out having a few drinks at night, chasing broads and women, but I mean, and the very next day, I can't walk. I said, a loud mouth, I opened my mouth too soon, and that's when it happened.
I've tried foot baths. I've tried, I've tried praying. I've tried many things and been many doctors. I have a whole list of physicians that I've been to, and many of them just end up saying they don't exactly know how to solve it, and many of them will have somewhat, some solutions, but they don't really cure the problem.
So now that you know more about neuropathy and what it means, let me explain to you 3 common origins or sources of this problem. Number 1, it can be a hereditary problem, meaning somebody in your family, perhaps your mother, your father, your grandmother, your grandfather, somebody in your family previously had it. It means it's a genetic cause. The second cause of neuropathy is a structural or mechanical cause. Sometimes we can have pressure on a nerve root, either coming from the cervical spine or the lumbar spine. And when we have compression or impingement of the nerve root, depending on where it is, it may go down into our arms and fingers, or it may go down into our legs and feet. Now, the causes for this can be many. It can include past surgeries and scar tissue. It can include disc problems such as protrusions, herniations. It can include arthritis. The causes are many, and your doctor will determine if that is an involvement and exactly what the cause is. But what you need to understand as the patient, think of this like a garden hose. If there is compression or pinching on a garden hose, guess what's not going to flow through the hose? Water. And on the end of that hose, if you have a plant root system, that's going to wither and die if it's diminished or blocked, that water flow. So you can think of this the same in your nerves. If there is a mechanical or structural impingement, the nerve flow is reduced. That in turn reduces the blood flow, and especially as we get to the extremities or the distal end, meaning the tips of your fingers, the tips of your toes, your feet. And without that nerve flow and blood flow, you literally are starting to die and wither away with your nerve endings and your blood vessels. So how do we fix neuropathy? Well, depending on your exact cause will determine what the doctor is going to recommend. We have very exciting new technology here, and let me explain a few of them to you. We have what's called multichromatic diode light therapy. This is a very specialized wavelength of light that actually penetrates deep into the tissue, and it helps actually regenerate the nerve endings. The research shows you can regenerate damaged nerve endings 1 to 2 millimeters per day. That's pretty incredible. The other thing we will do is increase the circulation, and when we do that, we get 2 things. We get new vascularization. That means the blood vessels can actually regrow, and in addition to the increased circulation, your body's going to release more nitric oxide, which is extremely important for those nerves to create energy and be able to do their function of nervous transmission. It's done quite comfortably. Behind me on the computer, I have a picture of a actual light therapy unit, and it's very comfortable, very relaxing. Patients love it. It's absolutely pain-free, and in a lot of cases, you can feel a difference almost immediately.